condition that the whole world is encounter. It is an important thing that we are getting together in one or other platform. So in this instance, I think one of the thing that comes into mind is regarding one of the question that is asked into an anthropologist. Like there was a famous anthropologist, Margaret Mead. So one of her student asked her regarding to Margaret Mead that what she was feeling, what is the critical point of civilization, the sign of civilization in a culture. So when the student asked the question to the anthropologist and her teacher, the student was expecting that she would answer the answer like the sign of civilization in a culture was like inventing some clay pot, or to invent some steam engine, or you to some kind of path-breaking technologies that people believed that the civilization has begun. So most of our preconceived notion is that the human civilization has just begun on 19th century, when there was a huge revolution in terms of industry or so-called technology. But astonishingly, the answer of Margaret Mead was that she was answered that for her, the first sign of a civilization, the culture, was when she found that a broken femur bone is being healed from the fossil of a human being. So that gives an idea that even for all other species, when there is a broken femur is being happened, or if there is an injury to the hip bone, or any kind of those kind of vital bones, they cannot survive because they cannot fetch the food. They cannot move, and there won't be anyone to heal them. And there is moreover, there would be no one to care them. So when she found that before 3,000 years back, there was a femur bone fossil when it was found that it was healed. She told that it is the first sign of civilization, because she's saying that because of healing that femur bone, there was someone to care for that person to make it heal. So it is very important that there must be someone for making care, or to facilitate the healing. So in this world, when we are isolating in different parts of the world, we become quarantined, we become more and more out from ourselves. So when we comes into the same context of Margaret Mayer, in this kind of platforms becomes most advanced value of civilization, because we come together and we discuss many things, we learn together, we share our experience, we learn together, and at last we care for ourselves. That's more important. So in this era where I mean, physically when we are apart also, this kind of platforms make sure that our civilization still has more to hope. So I thank Dr. Neha and Arogyam that our civilization still has more hope to think about more positively regarding the future. So I am also very proud to say that I'm also part of Arogyam from the last 1 year. So this kind of community outreach programs, more than the science or evidence, it makes a sense that there are someone to hear for ourselves, there are someone to care ourselves. So from that, in the same line, when we talk about mental health, or psychiatric illness to psychotherapy or anything, I'm not saying that Indian philosophy, it's not about geographical India, you say. It's about the East. From India, you have China, Japan, Persia, where there was, where there was diversity of cultures, diversity of philosophies, which has a very valid kind of approach towards understanding the mind, understanding the illness, to care. So that was the approach that was unique in Eastern philosophy when you compared with the philosophy or the approach that was evolved in the West. Eastern philosophy has more holistic and more inclusive approach towards perspection regarding health. So in a nutshell, what we say in Eastern philosophy regarding health is that health is more like an adaptation towards the nature or your circumstance. So if you put together in that instant, even if you not point whether if you are suffering from any major illness, no point whether if you have any kind of congenital disease, whether you are down with so-called you have any kind of life threatening illness also. If you are adapting with your circumstances, if you are able to cope up with your circumstances, you still feel that you are healthy. So I think if Dr. Neha still has many experience with WHO, that is a problem with the definition that we have already built with Western philosophy, or so-called philosophy or science that is driven as reductionism. So if you see the approach of definition with the WHO, that says that health must be physical, and it must be a complete state of physical and mental, social and spiritual. But if you put that in a complete, the definition itself says a complete. So if you think, who is going to become experiencing a complete state of well-being? If you're going to find someone like that, you cannot find anyone in the globe. So that definition itself make whole person in the global as diseased person or illness in that aspect. But contrary with that, our Eastern philosophy is more regarding adapting to your circumstances. So when you have that kind of philosophy, when that is put together, even if you have an illness, you still can be healthy, because of the fact that if you can live adapt with your circumstances, if you can cope with your nature, so you can still be healthy no matter what illness or what disability you have. There are many disabled person still living as healthy. Why? Because of the perspective of Eastern philosophy, or the philosophy of holistic approach to say. So in that context, I would say that first, let me just have a brief outline regarding how the so-called Eastern philosophy or Indian philosophy is approaching mind, or basis of mental health. So in that context, if you see Indian philosophy or the philosophy that is spread all over from East, it is moreover like the feeling of ultimate happiness is the ideal condition for health, even if you count of physical health or mental health. So if you say the ultimate happiness, that is represented as anandam. So there is a word in Sanskrit, like we will say that the ultimate happiness or the inner happiness is denoted by the expression of ananda. So that is the ultimate path to reach into your life, where you can feel that even without your money that you make, even without the recognition that you make and bring with your work or profession, even what are the objectives that you are going to make out, if you can remain happy, that's going to determine if you are success in attaining that path of your life. So ananda in that context means it's an ultimate happiness devoid of what's all your objectives that you are keep in your mind to make in focus as your life, or if you think that achieving that makes you happy, those things are parts of your happiness. So there is a gross difference between your happiness and ananda. For happiness, it's a more temporary thing. If you buy a new car, if you get a new promotion, if you clearing a new kind of exam, if you having an invention, that can make you happy, but it's a temporary thing. But if you say about ananda, that's an ultimate thing. If you lost everything, also you can feel out ananda. So the ultimate objective of your health and mental health status in Eastern philosophy is considered to be the goal towards reaching up to the ultimate experience of ananda. So in that way, Ayurveda is one of the things that make um, sustains your physical body, and some kind of your gross body to make in that way. And yoga will also help your mind to calm down, and your mind and soul to be realized yourself to reach into the ultimate happiness level. So put together all those things, Ayurveda and yoga, this both will make you in the way to experience the ultimate happiness of life. So that knowledge is essential, because that knowledge is considered to be the ultimate the way that is pointing out to reach to experience ananda. For interesting thing, if you can search in Google after our interaction, there is an neurotransmitter that is being named as anandamide. It's interesting to name that. Its name is anandamide. So anandamide is a neurotransmitter, is a chemical that's secreted in our brain. That's the name itself comes always. The name is being also attached for that neurotransmitter because the scientist has realized the significance of Eastern philosophy, so that he has given the name of that receptors as anandamide, because that anandamide is one of the responsible receptors that is, to enhance the happiness, enhance the well-being, your perception, your knowledge gathering, and many other wide range of your activities, your engagement. So you can see the multiple influence with the word of ananda in terms of understanding of happiness in the current scientific era also in that manner. So interestingly, to go more forward, if you see yoga, the yoga says, I think still I'm saying, even now you also will be accustomed with many meditation techniques, yogic breathing and everything. Even Neha ji is one of the expert. Even she can explain it more better. But still I'm saying one of the basic objective of yoga is chitta vritti nirodha. So if you see the Chittavritti Nirodha, what it mean by Chittavritti Nirodha? Chittavritti Nirodha has a very multiple definition, multiple meaning when we goes through that, interpret to that. But the critical meaning that suits with the life and philosophy and the objectives of and the context of our ultimate happiness is that the knowledge that we build, the experience that we build from the physical world has limitation. So the yoga says that your experience with the current physical world, your knowledge with the current physical world has a limit. So that enables us that whatever you experience in this world, whatever the knowledge that you gain in this world has limitations. So don't obsess with that knowledge. Don't get attached too much with the knowledge. So that's why the first sentence, if you say, as the the objective of yoga is like, as we say, chitta vritti nirodha, that to make sure that you are not get engulfed, or you are not going to be get attached too much because of the physical knowledge or physical experience that you are gaining from your sensory organs. So in that path, when you say the philosophy, again the yogic or the Eastern philosophy says that the cause of the dukkha is the word that the sorrow or any unpleasant situation that keeps you away from ananda. Me or everybody is we are so much attached with this physical world. Even when we chanting yoga, when we chanting mantra, when we are practicing many techniques, we are still still one or other way we are taking granted that what is happening in the physical world is too much real, and we are attached to it. So in that aspect, if you see the total philosophy of the framework of yoga, so it plays an important role to keep away slowly, and to make the awareness that is more important. Even if you are experience a physical world, you must have the awareness that it is not that you have to take it granted. So there the awareness plays a role. So even if you say the modern psychology, or Thomas Gustav Young or many other psychologists who says that awareness is the ultimate that provides you the insight. So in that way, if you have the proper awareness of ourselves, what is the problem that we face today? What is the unpleasant situation that we face today? Why we are experiencing it? So if you have that awareness, then we can slowly come to know that it is why, because of the too much attachment that we have, and we are taking granting many other things that goes on, and we are attaching our emotions to it, we are attaching our experience to it, so that we think that it is all real. So that reality, and that pseudo reality or that false imagination is causing unpleasant experience to us. So that is termed as dukkha. So we have ananda and we have dukkha also. So sukha and dukkha. Sukha is like a temporary happiness that we say. Dukkha is like all the unpleasant situation in your life, the setbacks, the trauma that we have experienced. Even everybody experienced, even me and you, despite of our efforts. But we have to make sure that one day we are going to reach in that level of awareness where we don't want to experience the dukkha. We, our only path is to reach into the ultimate happiness. So that is the ultimate struggle, and that must be the ultimate way that we can move forward. So when we think about the unpleasant experience that we may can have, If you just see the very interesting experience, and there is an interesting story um, related with the Buddha. When Buddha was born, there was one astrologer who was saw his reading, and he told to his father, who was a king, that this boy will either become a king or he will become a beggar or a sadhu in that instant. So his father was feared, because we will think only about negative. We won't think suddenly about positive things. What if he became a king? He won't think like that. He was a normal human being like us. So generally, the negative thought was being driven him. So he was thinking that what if his son becomes like a sadhu or a beggar, you know? So he had this obsession all around life. So he thought that his son must be always founded upon happiness. He must be always surrounded upon happiness. He must not be exposed with any kind of unpleasant situation or any kind of unhappy situation. So he nurtured the adulthood, up to adulthood, Buddha, with all kind of pleasures, all kind of happiness in his throughout life. Even one point when Buddha realized that one of his nearby person in his home, he was brought dead, and he was went into the burial ground. Buddha asked, oh, what happened to him? So somebody answered him that he has died. So Buddha got very astonished. He was never known that people will die, because up to that age he was founded with the happiness, and not unpleasant experience was exposed to him. So he was astonished. Oh, that will happen to people. Oh, it's a very very sorrow thing. How can one experience a death? So in that instant only, after reaching an adulthood only, he come to know that people will die. So that was the condition when Buddha was evolved and nurtured upon with all full happiness. Even in contrary, you see that after when he born and when he was progressed and he became the king, he has sacrificed his whole position, and he went and he realized how to reach into the path of ananda or ultimate happiness by devoiding and aware of. That is an important thing. Even if you say the Buddha, he will say, just aware of your breath, that is going to save you, that is your master. So he was aware of where the dukkha is coming from. So he found out in a one path of his life, he was also depressed. If you see the writing of Buddha, he is explaining in the early ways that he had all the symptoms of chronic depression that we can name as the classification of disease. If Buddha was here, he may be, I think, suggested to look for a psychotherapist on you. Even he may be prescribed with any Ayurvedic or allopathic medication for even depression. So that was the symptoms, and he was unhappy. He had many kind of troubles in between. But one point of time, he realized the all sorrow that comes with the sensory organs bounded the physical world. So he decided to have his strong awareness from where this emotion comes, from where the we can reach into the ultimate happiness. So the Smriti meditation or any Ayurvedic philosophy or yoga philosophy, different school of to Eastern philosophy are focusing on that point, how to eradicate the dukkha and how to make you understand and experience the way of ananda or happiness, how to make the awareness of your thoughts, and so just to have this. Have you started the Nehaji? Have you put the presentations on?
Yes, it's on.
Okay. Yeah. So we have Ayurveda and Yoga, we have the perspective towards health and mental illness, or the perspective towards an identity of individual. We say that towards more holistic, and there is a consciousness based. In Western medicine, there is a reduction. We call it as methodological reductionism, where the mind is a different thing, physical body is a different thing, the consciousness is like divide of chemicals and many neurotransmitters. But in Ayurveda, we have more like consciousness is an ultimate. So we considered the soul, and realization of one of soul as the ultimate ultimate objective to realize what is life. So we have more like a consciousness based approach towards health or purpose of life. That is an important thing. So if you ask the science or modern science, what is the purpose of life, it would be difficult to answer in truly in science manner. So if you see in Ayurveda can answer the question regarding what is the purpose of life in both way, in terms of the science of physical world, also in the consciousness. So to know about the knowledge of yourself, so that we called as atma the vijnaniya. So to know, to have the awareness of the your inner or your soul is considered to be the ultimate goal to achieve health, or ultimate I mean, I would say that it is the finding the purpose of life in that way. So we have more consciousness based approach in realizing life and evaluating the health ultimately. Next slide, please. So today I think we are more on to many fibromyalgia and chronic fatigue syndrome and everything. So if you see this diagram, you can feel that we have somatic illness, we have a mental illness, but the psychosomatic illness is like, it's like more interconnected in between. So it is not negating the fact that someone is having a physical illness, but it is more rooted that it is being enhanced, the symptoms, or the severity or irritation or the experience, you say, no? That is being more enhanced because of the mind. So in that way we are defining psychosomatical illness as like there is more and more involvement of mind in experiencing kind of symptoms and illness. So, but in Ayurveda, we don't differentiating much from mind and body. So we have, it's like a reflection where how your mind is decided by how your body, and vice versa. How your body behaves is also influenced by mind. So for us, most many disease has this kind of link as psychosomatic disease. That's why in Ayurveda, the first the verse of the first chapter is stating that ragadi roga, so that the disease has more root in many kind of psychiatric or mental emotions and mental dimensions in it. So ultimate ideal doctor or a vaidya in Ayurveda is considered as who can evaluate it, how the mind is influencing in one to cause as a disease, and one is capable to reverse that kind of disease in the mental, in the deep root of the mental faculty, also considered to be the ultimate vaidya in that aspect of it. So there is a prajna barada. Prajna barada means we in our as we have discussed earlier, when we engage with our daily life, physical reality and physical life, so called the life that we live, we bound to have many errors. That is called the intellectual errors or prajna barada. So these errors will contribute as an illness, or this can transform as a mental illness, or it can transform as a physical illness. Most probably this can transform as psychosomatic illness. So many there can be many enlisted causes of intellectual errors, like even if you know a certain thing is bad, if you are doing that, and you will have a feeling of guilt. Many, we feel that in our daily life when we, I mean, there we have some kind of true right or wrong, we stand in between, we take one decision because of many kind of force or influence, but later on life we have many guilt because of the decision that we have taken. Then we will think whether it was ethical, whether it was right, whether it was righteous, whether I was I was what does it is going to influence others because of my decision. So all these kind of decision making can also transform as illness, or it can transform as any kind of symptoms also. So this can enlisted as prajna barada or intellectual errors. Next slide. So it is very important, somatization of emotions. So it is mean that when you have a strong emotion in your mind, so I think all everybody would be have much accustomed with these things, because you already had many sessions regarding from mental health experts to therapists and everything. So I think everybody will be having many exposure to this kind of phenomena where that happens. So just imagine, if there is an interesting thing, even when we were medical students, even if you see many medical doctors, there is a medical disease syndrome. So that what all the disease that you are evaluating or you are treating the patient or reading, you feel that that disease may can affect you and you will be more obsessed with that kind of condition. So in that way, what will happen is that your mind will be revolves around all these kind of symptoms, and your mind will place many networks in your brain that is going to make more imagination that appears to think you that this is real. So again, when we are connecting, like what we have discussed earlier, our experience that we make in our physical senses, that creates us the false thoughts that these thoughts are going to be real. So if you just think that many of our problems comes from the imagination that and the narrative from ourselves, that what are the thought that we carry is going to happen for sure, or that is going to be real in almost all sure. But the thing is that many of our thoughts are just thoughts. Those are just like a normal phenomena. If you are not obsessed with that thought, as I told earlier, if you have any kind of obsession that certain of your pain can worsen like a cancer or something like. So first thing that we will do is we will go and search in Google. So you will have a very big list of symptoms. So you are going to, if you are fear that you may get cancer, so you will be having all symptoms screened with yourself, whether I have these symptoms, I have that symptoms, and after 2 days you may transform many of symptoms with your own. So that is mean the somatization of emotion. So you are already having a narration that your pain is, you are thinking that the pain has any relation with the cancer. Then you are going to link that all with the symptoms that you have already read. Even interestingly, you will have in mind after some time, you will make your own diagnosis. You will make your own clinical guidelines. We will make our own, textbook of guidelines. We will make sure that we are a patient, and we will think that we are going to die soon, and we are going to affected, and we are going to bedridden. That is why, because of that, we are taking granted that the thought that we have, the emotion that we have, is going to be a real one, and the real one is transforming that emotion into symptoms. So there we are saying how the emotion is transforming to symptoms. So in this context, if we have a feeling that certain pain that is going to disturb us, or we feel that that is going to disable us, then we are only thinking that the pain is going to make us disabled, and we will think that I cannot do my work, I am not going to be productive in my life. Then what will happen, you will be having many experience of others who has become disabled with any other disease. So we will be attaching many of our symptoms to them, and will be worrying that we are now itself we are going to be a patient, and we are waiting a very sorrowful life because of our symptoms. So there you can clearly see how, even if just look at ourselves, just aware of yourself, we can just experience how our emotions are many a times changing into somatization. Even just before an exam, or before an interview, we feels that many of our emotional outbreaks with a hormone turbulence, and many other things are transforming as many wide range of symptoms and everything. So in that little experience in daily engagements, and even with many our physical symptoms, this emotional somatization plays a major role. So from the starting point, what we have to take is that we have to clearly put a gate between what is our thought and reality. So that is the place where we have to stand in between. We have to put our strong awareness in between to make sure that we are not taking granted by our imagination or our thoughts. Let the thought goes its own way. What will happen is that when we are sitting around the thoughts, the again the thoughts will become more imaginative, and our brain will become more boosted by the thoughts, and our brain will become more wired by these kind of thoughts. So our brain will be more notorious things, and we will think that ourselves we are the most unlucky person in the world to experience this. It is because of the fact that we are surrounded by the thoughts, not by the reality. It is only because the thought is the problem, and our action towards the thought is the problem. Even if you will have other 100 thoughts, but you won't be responding to that thoughts. So in when we come to the somatization, the important thing is that how we respond with our thought. Even if you have a very dreadful thought, how you are responding to it. If you are suddenly forcing it to stop, then you have many other symptoms. You have agitations, you have distress, and that will eventually transforming into many physical symptoms that we can see later also. What are the general physical symptoms that we can note down when we have this kind of different um, mental expressions and all. So it is important that how we respond to that thought. So first thing is to have the proper awareness. Second thing, it's about how we respond to our thought, because our response is the influencer for our thought to become more notorious. If you are not responding to the thought, and if you are awareing that, if you are taking a more awareness position that let the thought go, it has no meaning in my life, it has no meaning with the reality, then you are more comfortable because you are not going to act by the thought. You are not going to be affected by the thought, and you are not going to be agitated by the thought, because you are aware that these thoughts are not real, these thoughts are just manipulation of your mind, just manipulation of your sensory organs, and you are not going to act because of this thought. So if we are able to success in that way, then we can make sure that we can make our all fearful thoughts, or what are the distress thought happens to our life, we can overcome it, because we are not fueling our distress thought anymore. We are stopping it, and we are making sure that we can control it much better. So there is an interesting story. Many people, even me, and many we were discussing. There is already when people comes to us and they will say, we are trying to forcefully, resist our thought. What all the distress thought, the trauma that we had in the past, many other bad thoughts, or we are trying to forcefully resist. What will happen, when we are forcefully resisting it, the moreover it will gain the power, moreover the mind will be alert on that thought. So it will imagine, and it will increase in a multifold way. It will take you to the different path, it will make you to experience different kind of distress, because we are already in this thought. There's an interesting thing. If you just observe that, we are going in a we have to take a flight to go somewhere. So we are just going in a very rush traffic jam. In India, we have this thing, when we are having always, like, we will always we will start at late. It's a very Indian behavior. If it is an Indian railway, we will take it granted that the train will arrive late. So we will always make sure that we will be starting our journey not much in a time. So when we are moving in a traffic jam, there will be a huge rush in the road. So we will be distressed. We are not sure whether we can getting up to the airport or railway station. So we'll be having distress. We will be having anger with many people. Even we will have an anger with the system who have built the road. We will be thinking that why the road is so poor. It can be broadened much better. Why India has this much population? All these thoughts will distress, and many different kind of thoughts will be there, because we are feeling that whether we cannot reach in the timely. But if you see, if you are able to reach in the time in an airport, and if you are flying up, and if you are seeing the same traffic jam from the upside of the sky, you can experience and enjoy that the traffic jam with a huge sigh, and you can experience how beautiful is this from when I'm saying from the upside in the sky. So it is just like putting a distance from our worrying thought, putting a distance from the distress thought, putting a distance and awareness from that. Awareness itself make us to see our thought of distress, or the trauma thoughts, or anxious thoughts, to keep a distance, to see how it is really appearing. Then we can make sure that what is actually meaning to ourselves. Then only we can make sure that the thought has nothing to convey as a meaningful thing. So we can easily overcome the thoughts in that way. So as we have discussed, if you see this sadness, how the sadness, these things are based on our observation, and our network of practice that is being documented as part of psychotherapy. So the sadness, anger, fear, guilt, and offense, hopelessness, and indecisiveness, stress at work. These things and emotion has many link with physical symptoms. If many people are saying, I have a heavy chest, I have a pain, I have a recurrent neck stiffness, I have a butterfly in my stomach. These things also convey what is your mental emotions, your status of mental health also many a times. So these things are also convey deep rooted mental emotion that is being not addressed. So we consider these things are also part of a chronic emotional distress or agitation or something like that. So just coming into this way of Smriti meditation, Smriti meditation, as we just compiling everything, it is a technique that will help you to expand your consciousness and to expand your awareness to make to have a much more better management of our mental emotions, so that it will provide you more better awareness of your thought. It will provide you more broad of your consciousness to make sure that you are in a safe position to observe your thought and to not respond with your thought, and that cannot no longer making you distressed but keeps you in the path of ananda or happiness. Next slide, please. So in the Smriti meditation, um, we have a difference between any other psychotherapies that we usually say, like we have CBT. You will be always. I think many of participants and friends out here would be exposed with that, isn't it? In the last sessions, like cognitive behavior therapy and exposure response therapy. So apart from that, Smriti meditation is a difference in because it deals with more depth engagements with subtle aspect of the mind. So we in yogic science, the level of mind or level of subtle status of mind is being classified into Jagrat and Sushupti and Swapna and Turiya and Samadhi. So Jagrat is awakened state, so fully conscious state where we talk, where we live, as we told, and it's like the world that and experience of our general physical reality with all our sorrows that we happen and temporary happiness also. But when we move on to the higher plane of experience, we have this kind of sopna and we have turiya and ultimately samadhi. So in that subtle level of our mental health, or subtle level of our subtle body, we can experience that our experience more comes from the awareness, not comes from the limited engagement of our sensory organs nor the mind. So you can see the percentage in each status. If you say the awakened state, like Jagrat will be fully influenced by sensory organs. If you comes up to the Swapna is like the state of dream. So if you see that there will be more influence of the mind, but less influence of our sensory organs. But if you see get into Turiya will be more influenced by the consciousness or the ultimate level of subtle experience. So in Smriti meditation, we facilitate the participants. In Smriti meditation, it is not just like the therapist is going to um, impose something. He is going to impose some thoughts. He is going to impose some positive thinking. It is not like he will facilitate the participant into reach into the subtle level of his mind, subtle level of his subtle experience to really and aware what does it conveys to him, what is the level of awareness that he can expose when he is reaching into that level. So when a participant is being facilitated into that level, he can aware what is his real problem. The problem is that many other psychotherapy, the limitation is that many other psychotherapy is happening in more superficial level of physical body or physical reality. In that level, we cannot find what is our problem because we are limited with our sensory organs. So whatever you counsel the patient, you give any kind of positive thoughts, the participant or the seeker cannot aware of it in full manner because he is not aware of his own consciousness. He is not aware of his own soul. So in Ayurvedic psychotherapy, we are facilitating the patient. We are trying to help the participant into reach into more subtle level of awareness, so that he can understand more better regarding about oneself, about the problems that where does the problem arises. Even the problem is that even when we talk into the awakened state, we cannot fully understand from where the sorrow comes, where the despair thoughts comes. But where when we are in the level of subtle element, subtle state, it can be easily understood because it's a strong light that is being put on in your inner self, so that the light will be there to see around yourself, to experience your ultimate awareness. Then you can feel from the where does from the distress thought comes, from where the anxious thought comes, where does the fearful thought comes. So you can easily aware of that thoughts, and you can make necessary changes with your adaptations, or behavioral changes and many other things to overcome this. So that is the difference between Ayurvedic psychotherapy and another practiced psychotherapy. So we have up to now discussed regarding many elements. So jnana is important in Ayurvedic psychotherapy. So jnana means it's an ultimate knowledge. So ultimate knowledge that we have discussed, the jnana is the ultimate knowledge that going to make you aware of yourself, who you are. Ultimately, where does your experience come from? What the experience conveys to you? What does the emotion conveys to you? So if you have this real knowledge, then we can overcome all kind of sorrows. We at least we can manage it. I'm not telling that since we can overcome it, but I'm saying we can manage it consistently because of many practice, many exposures. We can overcome, that's for sure. But we can manage it better because we will get more awareness because of the right knowledge. So the ideal knowledge is important to have the proper awareness of ourselves, to proper discrimination between what is real and what is imaginative thought. So for that, our psychotherapy has this kind of 5 elements where we take account of the participant or who is the seeker. So one thing is like Vidya, Siddhi, Madhi, Meda, and Prajna. Vidya is like the information that we have. For an example, we have many information regarding our emotions, our fearful thoughts, or many kind of worrying thoughts. We may have many information. So in this aspect, in this phase, we will try to integrate with, or we used to engage with one by one to see how much information that we all together collect regarding our fearful thoughts or worrying thoughts. Then we will ask the participant to set a primary goal. What is your goal? That for an example, if you have a fear of darkness, you can say that my objective is to overcome my fear of darkness. So we will be in Vidya phase, we will be working all your knowledge that you gained up to now, all the information that you gained up to now regarding your own fearful thoughts or your worries or your anxiety. What is it? How it dealt you? How you informed it about it yourself? In that phase, we will be engaged with that phase. In another phase, Siddhi is like facilitating the seeker or facilitating the participant with the skill to how to cope up with the thoughts or how to adapt with the thoughts. It is moreover like when we moving out with the information that we have, then we can ourselves many a times we can acknowledge that many of our information previously we had was very limited because we haven't broadened our consciousness, we haven't broadened our perspective to our problem. So we can add upon many influence that we had in our childhood, we can have more information. So when we dealt in other phase of Siddhi, then we can the participant or seeker itself can point out what the skill he is lacking. So for example, I can say I'm not skillful to act on my thoughts, I'm not skillful to respond with my thoughts. These are the main skill, and I am not much skillful with maintaining the behavior because of my worrying thought. So these are the phase where we are working on to make it better, to understand it more better from the seeker point of view or the client point of view or the participant who is on the psychotherapy point of view. So in the Madhi, the next phase after the Siddhi, in Siddhi, as we have told, we will be knowing that what is the lack of skill that we have to overcome the problems. In Madhi, we are going to interconnect many other things. We are it's like the therapist is going to make you to facilitate you to fill up your all the dots that you already have. Maybe you have many problems with your childhood, maybe you have many unknown things that is happened when you are missed, that when you have currently feeling the problem. So in that phase, we are trying to locate many dots and we are going to connect it, what the whole picture will be looking up. So in the whole picture, then we can connect many dots, and we can feel that the primary problem that we first felt was not the real one. There was another problem, another mistake that we haven't taken much important before. So in Madi, we are trying to connect all the dots in many perspective of yourself or others point of view, or if, when you are a child, how you will be looking at the same problem, and each phase of your life, how you look at the problem. So in that manner, that will provide you an eagle's point of view to see how the actual problem as a whole will look like. So from Madi in Meda is very important, because in Meda, we will be having many kind of misbeliefs. We have many wrong beliefs, pseudo beliefs to which will worsen our emotional agitations, our emotional health and mental health. In India, we have many kind of, even if there is, we say that there is a tradition of misbelief which is being carried up from family to family. So there is an interesting misbelief that is already there. Very simple things that we say: if you laugh in the night, you are going to suffer a lot in the very next day. So the people will be so restricted; they don't want to enjoy their happiness in the night. So there will be so much restricted to make sure that they are not happy, because they don't want to experience the sorrow in the next day. So these are the very simple misbelief that is being transformed in our community and civilization. And from spiritual to religious, many misbeliefs are there that can cater to worsen your symptoms, worsen your distress, worsen your anxiety, and to make you more distressed. So in this way, we will be trying to locate what are the misbelief, elements of misbelief, how you can equip with the right knowledge and to overcome the misbelief. So prajna is the phase where you determine that what is your actual problem is. So when you travel from vidya to prajna, many a times we will come to know that our problem was not that was identified in the first. It will be changed when you're saying into prajna. So in the prajna phase, we expect the client to say that now I am clear with myself. You can please can you change the slide?
Yes, Dr. Lakshmanan, we're running out of time. So it's last
Yeah,
10
yeah,
minutes. We usually keep the question answered. And I understand
I'm going to stop here.
with the practice, I understand that we are also planning this Smriti meditation workshop, because in that way, we all can go through the group psychotherapy. But if that's a possibility and everybody is willing to do that, we would like to keep it one of the weekends, which is feasible for all of us at the end of the 12th week. But for now, if we can take questions.
Yeah.
Thank you. It is very fascinating. And of course, knowing that how this holistic psychotherapy, the Smriti meditation, really has a different approach. But again, it's a matter of practicing and acquiring the right skills to understand and overcome. But in this regard, anybody has any questions or want to ask or suggest anything, please feel free to do that. I have one question from the discussion which we had now. What I heard, you said about knowing the problem, the root cause. But if something has happened long back, which like an early childhood or early childhood really, where we don't even remember the incidents, how does this work in those scenarios?
Yeah, it's a very interesting question and important to answer also. That's why many of if that has a root and that has an influence in your current traumatic thoughts, agitations and everything, we can surely find out with when we are moving into more subtle level of mental state. That's why I told in Turi, and when we meditate the patient and to facilitate him to more subtle way of mental health and mental status, when we integrate with them in that level of subtle mental status, we can come to know that what is the the strong impressions are still would be there, because those things you can only find into the subtle level of your mind, or mental plane. So otherwise, if you are just in awakened state or conscious state, our body and mind will mask it, because it does want to appear it before. So we will be knowingly, we will be trying to mask it to make sure that we are not we are not experiencing it, or we are not realizing it in that level. That is because of that we have already told that it is because of the fact that our mind and sensory organs has more influence. So when we are moving on to more in-depth level of mental plane, we can come to know that the impression is already there, that happens in your childhood. So that with proper awareness, you can find out what was happened when you are a child, or the past.
And if that's a significant trauma, even if one of us realize which brain and the body both has shut it down, because to prevent the further trauma, which we see very commonly happens on body level and mind level, is it not we are exposing to those latent memories all over again to be exposed?
Sorry.
So is it not that it is not like similar exposure therapy? So the
No, 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 no.
very
That's why, yeah, yeah. That's the difference. We are not imposing any kind of thoughts, or we are not forcefully impose anything to the client or participant. We will be slowly will in when we are passing to each phase of this, from vidya, from the right knowledge, when we are to make sure that we are connecting all dots. That time itself, we can expect that the participant will get some kind of courage or inner awareness in that way. So he can just aware of his own thoughts, then he can see how the appearance of his traumatic thoughts. So we will make sure that we are not imposing any forceful way to experience the participant for that traumatic thought. We will stand with the, and we will go along with the participant to experience himself. But in that way, we will prepare how he can, with his awareness, he can prepare it for better, and how he can better, he can aware of it. So in that way, we are not forcefully ask them to expose it with the traumatic thought, but consistently making him more courage, making him more aware. We will be facilitating them to whether to aware of that thought or not. So many a times, for an example, we had one observation where one of our client was, he had a very panic attack when he used to sleep in the darkness. So every time when he switch off his light, he used to get many panic attacks. He used to get extreme anxiety, tension that was reflected on his gastrointestinal disease, acidity, to many chronic illness. So when we have had this psychotherapy in each level, at one level, he told that when he was remembering his childhood, he told that his father and parents were so afraid of him to go into the darkness. So when he was going, they used to put the light on. So they were always making him to say that it is always danger to go in the darkness. So in that impression was there from his childhood, that he was analyzed and he was evaluated and he was aware when he was on the meditative level, and he was aware of himself, and he became on more subtle level of experience. So he told that it is experience that made him to fear when he had this kind of problem when he switched off the light. So for interesting, after the session on the very next day, he found improvements. He started to sleep even without light and everything, because he had the proper awareness that this problem came when he was a child, when his parents were forced him to not go into the darkness. So it was there was many disbelief, many traumatic experience and many things clubbed over that, and it was there in his impression. But because of interaction, because of his subtle awareness, he able to overcome it. So it's an better example, I think, to understand the question.
Yes, I would like to ask you uh, the third slide,
Yeah, please.
before Sushipti, what is that? Because the slide was very dim, I could not read. The third slide it was, I think. Conscious level.
Swapna, Jagrat Swapna, Sushupti Turya. Swapna.
Supra. Thank you very much. Thank you.
Yeah, yeah. So can we have a 5 minutes some simple meditation to end up if there is no thought questions or
Yes, yes, please, Dr. Lakshmanan. Thank you.
okay. So it's a just an induction meditation or a simple meditation that we use to just have an awareness of the thoughts. Okay. So I request everybody to close your eyes. Just sit in your comfortable position and just inhale, exhale slowly. Just try to slowly focus on your breath. Just try to focus yourself, your breath. What is the experience that you are gaining when you are inhaling and exhaling? Whether your inhaled air is hot or cold. What is the sensation that creates it in your body? How is your surrounding? Is there any noise? Just try to aware of all. Just try to aware of your temperature around you. In a moment, just try to aware your environment. There can be hotness or cold, any other experience, any sound from the outside. Just try to experience it as it is. Now you are experiencing yourself also. You are breathing, the way you are breathing. It's constantly happening in your body, the rhythm of your breathing. Just aware of your rhythm of breathing, how naturally it is happening. Don't force yourself. Just try to aware of it, how it is happening naturally. You can feel the rhythm, the natural rhythm of your breathing, the sensation that it brings, the air, how the air experience to your nose, your throat, and your lungs, whether it is produces any hotness or coldness. Just try to focus on your breath. Now you can just focus on your legs. You can feel about your legs. Your legs help you to walking, help you to standing, help you to balance your body. Just try to aware of the shape of your legs, how you are sitting, how you are there, the posture of yourself. Just try to take it revolves around your shape of your legs through your mind, how your legs is being placed in your body. Now you may can experience any kind of numbness or your chronic fatigue or you are worrying kind of pain. Just aware of it, where it is being located, where the site of your pain in leg, how you are feeling that pain. Just try to aware of it as you can feel all the expressions there, your muscles, to your bones, to all the tissues that is there. You can experience and aware all the sensation that you can have. Just try to aware of it as it is. Your worry and your distressing symptoms that we are experiencing. Just to of it, how it affects you. Focus on the shape of your hip joint, how your hip is being placed. navigate what is shape of your hip joint. You can
you're muted, Skanthesh.
so you can just aware of your spinal bones, just aware of your bones, how it is, how it is shaped, any burning sensation, any pain or any kind of fatigue over your back, any kind of muscle damage or anything that happens. Just try to aware of your feeling and expression. Now you can just go up, you can feel your neck bones, your neck, which helps to place your head and brain. You can feel the shape of your neck bone, how it is being placed in your body. You can aware any kind of sensation over there, any kind of pain over there, any kind of stiffness over there, any kind of worries that limits your movements, any kind of worries that limits your life engagements and everything. Just try to focus and aware of the expression and experience that you have around your neck bone and muscles. Just try to aware of the feeling that you have. Now you can move little up. You have a head, you have a skull, and you have a brain inside. Many vital structures are there. You can just aware the shape of your skull and head. Just try to make a revolve around your head and your skull through your mind. You can experience your sensations, your pain, your headache, stiffness, burning sensations, your pricking pain, any unwanted thought that creates problem in your head and worrying you. Just try to aware and focus on those. You are now capable of aware all of this kind of symptoms or expressions. Now you can just focus on your heart. Your heart is pumping the blood to all the tissues. It is constantly pumping. It has a rhythm. It is providing the nourishment to all your tissues, your life. Just try to imagine how your heart is pumping the blood and the blood flow to your tissues. Just try to focus on your heart, how the heart is functioning by its own, how you are able to pump the blood from the heart to all the tissues. Just aware of the functions. And now you can feel any stiffness that you have on your chest, any kind of cough or heaviness, any kind of pricking pain, any kind of other worrying symptoms that you have. Just try to aware of it as it is. Now you can aware of your breath well than earlier. You are more settled. You have more awareness now. Now in a moment, just try to think about your worrying thoughts if possible. The thoughts that keep you down, the thoughts that make you down, the thoughts that say that you are a failure, the thoughts drags you down, that thoughts keep you pain, that thoughts keep you worrying. If possible, just try to aware of that thoughts. Just try to focus on it. How it looks like, how the thoughts appears in your mind, from where it comes, what you are experiencing now. Just try to aware of it as it is. Just for a moment, you can aware of it, how the worries, thoughts appearing in your body and mind. Now you can slowly imagine that you are able to overcome all of your problems through your constant awareness. You have got more awareness that you can now differentiate between your reality and imaginations. Now just imagine how you will be without all these worrying thoughts and how you will be engaging in your life, how happy you are without all these kind of worrying, painful, degrading thoughts. That is possible. How you can conquer it. Just aware of those moments when you are truly out of that moment and you are living with almost your happiness and you are truly marching in front of the path to the ultimate happiness. Now you are getting more clear, you are getting more power, and you are able to walk with a confident happiness. Just imagine how you will be without all these kind of thoughts. Imagine. Now your thoughts and worrying thoughts are just become a drop of water, which was looks like a mountain of fear. Just aware and focus the way how you will be without overcoming everything. You are with all your potentials, your happiness. You are back into your life with more power. Just imagine one of your moments in life when you are happy, when you are truly potential, when you are more confident. Just aware of that moment. Just aware of that moment. Now slowly you can rub your hands. Now everyone can rub your hands. The warmth in your hands can be transferred into your eyes. You can slowly open your eyes. Just aware that you are slowly opening in your eyes to a new world where you are able to better manage your problems. You know, it's possible that you can overcome your problems. Now you are into a new world. Hope everyone has a good experience.
Very nice, very relaxing.
Thank you.
Take away my backache, It's taken away my backache.
Thank you.
Yeah.
Namaste.